Hello everyone, welcome to our health journey together. Today we're talking about cholesterol, a topic that's crucial for understanding your overall health and well-being. It's a term that gets thrown around a lot, but what does it really mean? It's a word you've probably heard at the doctor's office during a checkup, or maybe you've caught a segment about it on the news. Cholesterol is often mentioned in discussions about heart health, diet, and lifestyle. Cholesterol is a waxy, fat-like substance found in every single cell of your body. It's a fundamental building block, playing a vital role in various bodily functions. Your body actually needs cholesterol to function properly. It's not the enemy it's sometimes made out to be. Cholesterol is essential for hormone production, vitamin D synthesis, and even the digestion process. Most of it, about 80%, is made by your liver, a remarkable organ that works tirelessly to maintain balance within your body. But you also get some cholesterol from animal-based foods like meat, poultry, eggs, and dairy products. These dietary sources contribute to your overall cholesterol levels. So, cholesterol comes from two primary places: your body, through the liver's production, and your food, through the consumption of animal products. It's a combination of what your body naturally creates and what you introduce through your diet. Understanding this balance is key to managing your cholesterol levels effectively. Now let's talk about the different types of cholesterol. There are two main types that you'll often hear about: LDL, which stands for low-density lipoprotein, and HDL, or high-density lipoprotein. These two have very different roles in your body. LDL is often called bad cholesterol because it can contribute to the buildup of plaque in your arteries. LDL's job is to deliver cholesterol to your cells, transporting this essential substance throughout your body. But too much LDL cholesterol in the bloodstream can cause problems, leading to the formation of fatty deposits that narrow and harden your arteries. HDL, on the other hand, is the good cholesterol because it helps protect your heart. HDL plays a crucial role in removing extra cholesterol from your bloodstream, acting like a cleanup crew to keep your arteries clear. To make it easier to visualize, think of LDL as a delivery truck, transporting cholesterol to where it's needed, and HDL as a garbage truck, collecting the excess cholesterol and taking it away for disposal. Understanding these types and their functions is the first step to taking control of your health and making informed decisions about your lifestyle. When you know what cholesterol is, where it comes from, and the difference between LDL and HDL, you can make smarter choices about your diet and exercise habits. What you eat, how often you exercise, and other lifestyle factors all play a significant role in maintaining healthy cholesterol levels. This knowledge empowers you to protect your heart, reduce your risk of heart disease, and improve your overall quality of life. And it helps you live a healthier, longer life, allowing you to enjoy more time with your loved ones and pursue your passions with energy and vitality. So let's dive in and learn more together. We'll explore practical tips and strategies for managing your cholesterol and achieving optimal heart health. Cholesterol isn't just sitting around, it's busy keeping you healthy. It helps build strong cell membranes, the protective outer layer of every cell. Cholesterol is also needed to make hormones like estrogen, testosterone, and cortisol. These hormones are your body's chemical messengers. Cholesterol helps your skin make vitamin D from sunlight, which is vital for strong bones. Your liver uses cholesterol to make bile acids, which help digest fats. Without cholesterol, your body couldn't absorb important nutrients from food. So, while too much cholesterol can be harmful, your body truly relies on it for many essential jobs. Your heart, that incredible engine within you, tirelessly pumps blood, the very essence of life, throughout your entire body. It's a continuous cycle, a rhythmic dance of contraction and relaxation, ensuring every cell receives the oxygen and nutrients it needs to function. This vital blood flows through an intricate network of vessels, a superhighway system within your body that needs to stay clear and unobstructed. These vessels, your arteries and veins, are the pathways for life, delivering essential resources and removing waste products. However, too much LDL cholesterol, often referred to as bad cholesterol, can begin to build up in the walls of your arteries. This buildup manifests as plaque, a sticky, fatty substance that clings to the arterial walls. Think of it like gunk accumulating inside a pipe, slowly but surely restricting the flow. This plaque is a combination of cholesterol, fats, calcium, and other cellular debris. Over time, as more and more LDL cholesterol accumulates, this plaque hardens and thickens, progressively narrowing your arteries, reducing the space through which blood can flow. This narrowing makes it increasingly harder for blood to flow freely and efficiently, forcing your heart to work harder to pump blood through the constricted passageways. This gradual and insidious process of plaque buildup and arterial hardening is called atherosclerosis. It's a silent threat that can develop over many years without noticeable symptoms. As arteries narrow due to atherosclerosis, your heart is forced to work harder and harder to pump the same amount of blood throughout your body, placing increased stress on your cardiovascular system. This added strain can eventually lead to serious and potentially life-threatening problems, such as heart attacks, strokes, and other forms of cardiovascular disease. The danger is that you might not notice anything unusual at first. The early stages of atherosclerosis are often asymptomatic, meaning you may feel perfectly normal. But the risk of developing serious cardiovascular problems grows steadily over the years as the plaque continues to accumulate and harden. It's a silent progression that demands attention. Fortunately, there's a beneficial type of cholesterol called HDL cholesterol. HDL, often called good cholesterol, helps by actively carrying excess LDL cholesterol away from the arteries, acting like a cleanup crew. HDL transports this excess LDL cholesterol back to your liver, where it can be processed and removed from your body, helping to keep your arteries clear. Therefore, maintaining higher levels of HDL cholesterol and lower levels of LDL cholesterol is the ultimate goal for promoting a healthy heart and a strong, resilient cardiovascular system. It's about achieving a balance that supports long-term well-being. High cholesterol is often a silent threat lurking within our bodies. It's a condition that frequently goes unnoticed, a stealthy health risk that can develop gradually over time without any obvious warning signs. Many individuals with elevated cholesterol levels feel perfectly fine, leading them to believe that everything is all right. This lack of immediate symptoms can be incredibly deceptive. No symptoms, but real risks. This absence of noticeable symptoms doesn't mean that high cholesterol is harmless. In fact, it's quite the opposite. The reality is that high cholesterol poses significant and very real dangers to your long-term health and well-being. It's a silent time bomb that can lead to serious cardiovascular complications if left unaddressed. That's why regular checkups and blood tests are so important. These routine medical evaluations are crucial for detecting high cholesterol early on, even before any symptoms manifest. A simple blood test can reveal your cholesterol levels, providing valuable insights into your cardiovascular health. Early detection allows for timely intervention and management, significantly reducing the risk of developing serious complications. The biggest danger is heart disease. High cholesterol is a major contributing factor to the development of heart disease, a leading cause of death worldwide. It's a condition that can silently damage your heart and blood vessels over many years, increasing your risk of heart attacks, strokes, and other life-threatening cardiovascular events. Plaque buildup narrows arteries. This process, known as atherosclerosis, involves the gradual accumulation of fatty deposits, cholesterol, and other substances within the artery walls. Over time, this plaque hardens and narrows the arteries, making it difficult for blood to flow freely. Restricting blood flow. This reduced blood flow deprives your heart and other organs of the oxygen and nutrients they need to function properly. It can lead to a range of symptoms, including chest pain, shortness of breath, and fatigue. If arteries to your heart get too narrow, specifically the coronary arteries, which supply blood to the heart muscle itself, the consequences can be severe. This condition is known as coronary artery disease, and it's a major risk factor for heart attacks. You may feel chest pain, called angina. Angina is a warning sign that your heart isn't getting enough blood. It's often triggered by physical exertion or emotional stress. If a plaque ruptures, the situation becomes even more critical. The rupture exposes the inner contents of the plaque to the bloodstream, triggering a cascade of events. A blood clot can block an artery, forming rapidly at the site of the rupture. This clot can completely obstruct blood flow to the heart or brain, causing a heart attack when the blood supply to the heart is completely cut off, leading to irreversible damage to the heart muscle, or stroke. Similarly, if a blood clot blocks an artery in the brain, it can cause a stroke, damaging brain cells and leading to long-term disability or even death. Both are medical emergencies and can be life-threatening. Immediate medical attention is crucial in both cases to minimize damage and improve the chances of survival and recovery. High cholesterol can also cause peripheral artery disease, or PAD, which affects the arteries in your limbs, most commonly the legs and feet. especially in your legs. PAD can cause pain, numbness, and cramping in your legs, particularly during exercise. This can lead to pain, infections, and sores that don't heal. In severe cases, PAD can lead to amputation. Knowing these risks motivates us to take action for our health. Understanding the potential consequences of high cholesterol empowers us to make informed decisions about our lifestyle and seek appropriate medical care. By adopting a heart-healthy diet, engaging in regular physical activity, and managing our cholesterol levels, we can significantly reduce our risk of developing these serious health problems and live longer, healthier lives. The good news: you have power over your cholesterol. Start by visiting your doctor and getting your levels checked. Your doctor can help you create a personal action plan. Sometimes lifestyle changes are enough. Sometimes medication is needed. A heart-healthy diet is key. Reduce unhealthy fats and eat more fiber-rich foods. Exercise regularly to raise good HDL and manage your weight. Even small changes can make a big difference. Find activities you enjoy so healthy habits stick. Let's fill your plate with heart-healthy foods. Oats and barley are packed with soluble fiber that helps lower LDL. Fruits and vegetables, especially apples, berries, and leafy greens, are great choices. Cruciferous veggies like broccoli and Brussels sprouts are nutrient-rich and low in calories. Healthy fats matter. Avocados, nuts, and extra virgin olive oil can help lower LDL. Fatty fish like salmon and sardines are rich in omega-3s, which lower triglycerides and reduce inflammation. Aim for 2 servings of fatty fish per week. Small changes to your diet can have a big impact on your cholesterol. Some foods can raise your bad cholesterol, so limit them. Saturated fats are found in fatty meats, processed meats, and full-fat dairy. Choose lean meats and low-fat dairy instead. Trans fats are even worse. Look for partially hydrogenated oils on labels and avoid fried foods and baked goods. Too much sugar can also lower your good HDL and raise triglycerides. Cut back on sugary drinks and treats. Smart swaps and moderation are key to keeping cholesterol in check. Your lifestyle choices matter just as much as your diet. Aim for at least 30 minutes of moderate activity most days. Walking, dancing, or cycling all count. Exercise boosts good HDL and helps control weight. If you smoke, quitting is one of the best things you can do for your heart. Smoking damages blood vessels and lowers good cholesterol. Managing stress is important too. Try meditation, yoga, or spending time in nature. Even small changes add up to big results for your heart health. Cholesterol is essential, but too much, especially LDL, raises your risk for heart disease and stroke. You have the power to make positive changes. Focus on eating more fruits, vegetables, whole grains, and healthy fats. Limit saturated fats and trans fats and cut back on sugar. Stay active, manage stress, and see your doctor regularly. Small, steady steps lead to big improvements. Invest in your heart health. You've got this.